family started in 2010, San Francisco. I came here in 2011. And then we have the newest office out in Las Vegas, which opened over the summer. So Vegas was spawned by the fact that the cost of a surrogate here in California is going up so rapidly. And I wanted to provide affordable surrogacy, or as affordable as I could make it, with the same sort of laws and protections that California has. The Nevada law also modeled after the California law, so you're in great hands at either of our offices. We can do a full surrogacy at all 3 offices, which is huge. It cuts down on your travel, it cuts down on surrogate travel, and the first baby that we have that'll be born of the new year is going to be born to a recipient parent from Oakland, conceived by a San Francisco-based doctor, and carried by a San Francisco gestational carrier, and will be born over at UCSF any day now. So we're patiently awaiting the arrival of the little girl. And I keep getting emails from the surrogate, but not about her being in labor. So we're very excited to be having, you know, that birth on the heels of being at men having babies. A little history about me. I started in the surrogacy journey, I guess. It wasn't quite in the industry yet. When I was 23, I was a surrogate at 23, and then I carried again. And then I went to work for a small agency based in Los Angeles, and I was fired. We definitely had different philosophies on how it should be done and cost. I didn't know how much it cost. I was in the dark. I had these 2 amazing surrogacy journeys right out of the gate. I carried for this amazing single, you know, gay man from Seattle, and then I carried for his friends, this nice gay couple from West Hollywood. And then I went to work for an agency, and I was like, what is all of this? I didn't realize there was all this bureaucracy and things that there is. So when I went to work there, I just wasn't a good fit. I was kind of a hyper person. I still kind of am, I guess, when I speak. But I was kind of like, I was really excited about being out of, you know, my second surrogacy, being really young and just like into it. And I was a little much, I think. So when that didn't work out, I was, you know, pacing in my apartment in Studio City, and I was like, am I going to go work for another agency? I really want to do this. I don't know what I'm going to do. And I was like, you know what, I'm going to start my own agency. And the rest is history. That's literally 5 years now. We've grown from just this one little bitty office where 90% of the work was done in my apartment to this 3 office, and now this egg bank that we're working on getting off the ground. So that's kind of the history of how we kind of came together. I mean, the second couple that I had, their friends became my first clients. They've had 2 babies with us already, and we've had like 25, you know, pregnancies so far. We're already expecting 3 out the gate this year and doing like 7 transfers this month. I'm just so excited to see what the numbers are for this year. Like, I'm so, like, every pregnancy is really exciting to me, and I'm still at that point in my career where I'm just excited for everybody, and I want to help as many people as I can. So that's kind of, you know, like, the energy is still there here, which is great. Our agency is completely different than all the others. We're completely wellness focused, and I think that comes from me being a multiple-time surrogate, and the fact that I carried 8 previous pregnancies. I've been pregnant. I'm 31 years old, just so you know, just in case you hear rumors. It is true. I am 31 years old, and I've been pregnant 8 times. So 4 of them a surrogate pregnancy, and I have 4 kids of my own. So I think it comes from that, is the fact that I had always prided myself on being the surrogate that could get to term. That was the thing. It was like, I have this amazing pregnancy history, nothing will ever happen to me. And I successfully carried to term all 8 times. And I wanted that at our agency, but I wanted surrogates to take better care of their bodies and to know what they were doing. Because when we start to get to 5, 6, 7, 8, we're really pushing it, and something eventually could go wrong. So some of our policies were based on the fact that I wanted you to have a good outcome without having to worry. So I started thinking about how we can make our agency better. So the first thing I did was reduce the number of C-sections that we let surrogates have, because currently the ASRM guidelines allow for a surrogate mom to have 3 previous C-sections and get pregnant for the 4th time with your baby. And if you go to like WebMD says no more than 3. So I'm not really sure like why that's allowed right now. And then we get into pregnancy history. So when I was thinking about how to make it even better, we had a surrogate that had asked for to have the option of having an all-natural childbirth. And I said, yes, so we put those in place, we can do that. But that's for another day. But, so I wanted to start educating surrogate about having vaginal birth, and then I started looking at like the number of times a woman should really be pregnant, which is something as a surrogate, you can expect your surrogate to work a higher number of pregnancies than your next door neighbor who has 2 kids. So clearly she's a surrogate, she's gonna have more pregnancies. But I was seeing some people that I knew who were surrogates, and like we were getting into these kind of extreme, like, it was almost like a badge of honor. It's like, I've been a surrogate 3 times and I have 3 kids of my own. And I'm like, well, eventually that's gonna give out. And when we're talking about a surrogacy, it's like, well, why are we taking the risk? It's like, think of how much money you're spending, like why would we take the risk in the first place? And I was thinking, you know, as I was doing more and more research, I wanted to bring that research to parents. And I felt that was something that nobody was talking about. So I said, you know what, I'm gonna take the first steps and I'm gonna completely ban the grand multi-pregnancy, which is a woman who will be pregnant for the 5th time with your child. So our surrogates can't have more than 3 previous pregnancies of our agency. Because pregnancy 4 will be your surrogate baby, and 5, she's out of here. When she delivers, she's done here. And why? Because we're able to reduce the complications that she could suffer by being pregnant. She's at higher risk of having like high blood pressure, gestational diabetes, placental abnormalities, when the placenta doesn't attach properly to your womb, and all by being pregnant with your baby. And my philosophy was like, it's almost like me, you know, selling you a $100,000 car and not telling you the transmission could go on in 9 months. And think of how upset if we got down the road, you're driving your $100,000 car and all of a sudden your transmission is out. It's like, you'd be really upset at me. Like, why didn't I tell you this? Why didn't your doctor tell you this? And informed consent only goes so far in my mind if I'm not telling you everything you need to know. So those are kind of some of the policies. We also have a wellness program where we have a nutritionist and a doula who's there to support your surrogate. The doula is huge because not only do we have a therapist like we're supposed to who does all of our psych evals and our MMPIs and keeps up with your surrogate, but now we have this other support person who, that's her whole thing. She's like in love with pregnancy. She's there at birth. She knows about pregnancy. And she's able to help not only combat physical ailments that pregnant women have, back pain and whatnot, but she also is there to provide that extra layer of emotional support. And a lot of parents are worried about the surrogate not having adequate support during delivery. So she's also there to support them during delivery, which is really, really huge and something that I'm really proud that we're able to offer. We also, California Parental Establishment State, we work with one of the best law firms down in San Diego who has been with me for a number of years. A lot of the professionals who work for our agency have literally known me since I was 23. Like, we have history, serious history together. And I love working with them and having them as part of this family and, you know, having them on as we're growing in such, you know, rapid and wonderful way. So they handle all of our legal stuff. We also have a separate lawyer out in Vegas and a separate attorney for surrogates. We've got a great donor database. It's all accessible online. So that is something else that is new for 2014-15 is we were able to database all of our surrogates and donors. So you're able to browse our database from the comfort of your home at any time. And you just, you know, let us know which ones you're interested in. Obviously do phone and Skype consults. We literally can do the entire process at all 3 offices, cutting down on the travel like I mentioned before. So those are some of kind of the benefits. Our fees a little bit lower. We're at $15.5 right now. We'll do no extra fee for the donor. So that's kind of big. We're not charging 2 agency fees. Let me think what else. We've got great relationships with clinics. We really, yes.
Is it currently less expensive to have a baby in Las Vegas with your agency than to have one here in San Francisco?
Yes, unfortunately, the going for a California surrogate mom is about $35,000 in extras. And that is, we're having a hard time finding ones that'll take less. So right now in Vegas, we can, let's compensate, surrogates are compensated 24 to 26. So yeah, it's a huge savings. And it's like a 45-minute plane ride, you know, from LA. It's an hour and 50 minutes from here. So it's really not that far when you think of the logistics of the travel and the fact that you have to travel to the clinic one time to give sperm and to have your lab work and then to get your baby. and then any other times that you want to visit. So in that sense, like it really can be a huge cost saver for parents to consider that. We also work with a great doctor out there who also gives discounted men having baby services, so we can put you in touch with him as well. Our agency also gives 2 pro bonos to men having babies. So there are 2 free surrogacies up for grabs at our agency. You have to talk to Ron. I don't know who's getting them or how that is, but you know, yes.
I'm sorry, I didn't understand that. The 2 things?
We gave 2 complete pro bono surrogacies to men having babies. So I'm gonna actually essentially work for 2 men having babies couples for free. So that's kind of been our big contribution. Last year we gave discounted services. This year it was like, you know what, we're just gonna give 2, you know, services to, you know, couples who are in need or wanting to discount, because you know it's a big process, and I know that their guidelines are pretty, you know, they're pretty good. Like I think you can make as much as like $150 a year and still qualify for discounted services, which is still really good.
You have surrogates, like a percentage of surrogates that are okay carrying twins, percentage that only want to do single.
All of our surrogates are willing to carry twins. We've never had an issue with that. It's on their application. We also have surrogates who are willing to carry for HIV positive couples, and I work with a doctor here in San Francisco who provides services to them as well, so we can also do cases like that as well. Any other questions?
What about insurance for your surrogates?
So all of our surrogates have an independent policy that they either purchase, or as we get to the end of open enrollment of insurance, our agency will bankroll and pay for. So you'll never get a surrogate mom at our agency that doesn't have insurance. So, because the only other option is to buy New Life, and we seem to have the right formula, and we take good enough care of them and support them well enough that they come back and they stay with us.
I have 2 questions.
Yes.
Does your company allow us to bring our own egg donor?
Yes.
And then the law in California is that you can do the birth, you know, so the both gay parents are on the side. Is it the same in Las Vegas?
It's the same, yes. The same criminal establishment process Vegas as it is here. Yes.
What's the, why the limitation on C-sections?
Because of the fact that women who have C-section, there's 2 problems that you have when your surrogate has a C-section. The cost is huge. She makes a C-section fee, which is sometimes $3,000 to $5,000. Plus we've got increased medical costs, housekeeping, childcare. So we've spent about $10,000 extra we don't have to spend. So that's one of the reasons. And when budget is a factor, that's a huge thing. The other thing is she's having a C-section is major abdominal surgery, which is something that a lot of people don't realize. So we're like literally cutting, you know, the baby out of her stomach. She's at risk of uterine rupture, you know, bleeding. Plus, in future pregnancy, she could have issues with the placenta attaching properly. And then when it pulls away, she has huge problems there. So we just wanted to reduce those risks whenever possible. So it's just kind of a proactive, responsible thing I thought was right for us to do. We have done it. We haven't had any issues, you know, keeping the database full, even with the stricter rules on that. Any other questions?
I'm curious about the agency you work for that you disagreed with. What was it about the agency?
We just had different philosophies on how to treat surrogates. There were some issues with issues that parents were having with, they were running out of money because people weren't giving them accurate cost estimate. And when you get to a point where your surrogate is pregnant, you're out of money, you can kind of fix their home. So there was just a lot of like little things that they were doing that I didn't agree with.
Okay? You guys, you want to get a head start moving to the next room? Or going to be in the hallway in a second?